Hello everyone, I'm Dimuthu Disanayaka. Today I am going to start a new module, that is Community Healthcare Nursing, NBNS 3604. Before talking about the lessons, I would like to give a brief explanation about this module. So basically, in this module, we are going to talk about what is community health nursing or public health nursing, what are the roles of community health nurse, and what are the programs existing in the world for community health, and how uh, each members of the community receive nursing care or their health care. So there are different, that there are different groups in the community: children, pregnant mothers, elders. So the each and every category receive health care, and there are different programs are launching to provide health care to these different categories. So we are basically, in this module, we are going to discuss about how community health nursing programs are conducting in Sri Lanka and throughout the world. So to complete this module, uh, you have to sit for an exam which is consists of 40 MCQs, and you have to submit the assignments given. So assignment carries 50% of marks for the final marks, and the rest of the marks, that is the other 50%, goes for the exam. So now I am going to discuss topic 1. Topic 1 is Global and Malaysian Development of Community Health Nursing. So under this module, we are going to talk about how community health developed in Malaysia and in other countries in the world. So these are the learning outcomes. At the end of this topic, you should be able to integrate community or public health history to current community health nursing services, discuss the contribution of religion to establish the foundation of community health nursing, differentiate community health nursing in various eras of development, and describe the roles of the World Health Organization and local government agencies related to public health issues. Now we'll move on to the lesson. So, public health nursing was introduced in the late 19th century by a nursing leader called Lillian Ward. So she defines public health nursing as a practice that is affected by biological, cultural, environmental, economic, social, and political sector, and as the part of the healthcare system. Public health nursing practices response to these factors through working with the community to promote health and prevent diseases, injury, and disability. So, the main focus of community health nursing or the public health nursing is to promote health and prevent diseases, injury, and disability. So, to achieve these goals, you have to work with the community. So this health of this public or the community will depend on the factors which as described here: the biological, cultural, environmental, economical, social and political factors. Now we see what is community health nursing or public health nursing. So community health nursing or public health nursing is a practice which was developed to accommodate the needs in a changing society and improving population's health through health promotion, disease prevention, and risk reduction strategies. So, the basic role of the community health nurse is to identify and find solutions to health problems of a specific community. Public health is community oriented. Um, especially it focuses on the health of the population while protecting the health of the entire population and improving the health of the community. So you can achieve this through educating the community, promoting of healthy lifestyles and prevention of health problems. So the core functions of public health includes identification of the problems, assessment of the problems, policy development and assurance policy development and assurance of healthcare, which form the foundation for public health and community health nursing activities. According to US definitions, or according to Levin, community health nurse and public health nurse are two different persons. So, community health nurse is any registered nurse who works in the community setting, whether or not educationally prepared for public health nursing. That is his definition, Levin's definition. Uh, According to Levin, public health nurse is a nurse with advanced education at master's or doctoral level that is based on public health science. So, uh, according to Levin's definitions, the community health nurse can be any registered nurse, while public health nurse is a nurse who is having advanced education at master's or doctoral level. But in different countries, these definitions can be changed. There are four basic components of community health nursing practice. So those are: first one, population health promotion and primary health care with focus on promoting and maintaining health. Second, illness and injury prevention. Third, community participation. And fourth, community development. According to American Public Health Association, there are key characteristics of public health nursing practice. So there are 5 characteristics. Those are, first one, the health needs of an entire population, including the unique needs of subpopulations and inequalities in health within population. Second, assessment of populations using comprehensive systematic process. Third, attention to broad determinants of health. Fourth, an emphasis on primary prevention. And fifth, applying intervention at all levels, individual level, family level, and the community level in which they live and the systems that influence their health. So now we'll talk about district health nursing. This is a concept exists in United Kingdoms. So district health nurses are senior nurses in the United Kingdom National Health Service who manage care within the community, leading teams of community nurses and support workers, as well as visiting housebound patients to provide advice and care such as palliative care, wound management, catheter and continence care, and medication support. Um, so you can see a district health nursing system in United Kingdom. So these nurses manage care within the community. So they provide care for the housebound patients, and they provide advice and care such as palliative care, wound management, catheter and continence care, and medication support. Then we'll talk about the settlement houses. So a settlement house, sometimes also called a community or neighborhood center, is a neighborhood-based organization that provides services and activities designed to identify and reinforce the strengths of individuals, families, and communities. This is also exists in United States. Now we'll talk about the community health nursing in Malaysia. So community health nursing services in Malaysia focuses on community health service development, rural health services, and primary health care. So when we talk about community health service development, so basically in Malaysia, hospitals were run by nuns, and later this was replaced by nurses from England. Sorry. So community health nursing practice came into play after successful establishment of nursing in 1956 with the starting of maternal and child health services. So maternal and child health services are the first community health nursing service launched in Malaysia in 1956. So the community health nursing in Malaysia focused more on activities, programs and initiatives within the community setting. So as I told earlier, community nursing began major milestones in 1951 when service centers for maternal and child health services became an essential component of National Rural Health Development Program. So, when we next component of community health nursing service in Malaysia is rural health services. So, in earlier period, so these health services focus only the urban areas, but um, after extensive development of health infrastructure facilities, uh, under National Rural Health Development Program, so these rural health services began. So, as I told earlier, maternal and child health services remain as the main component of these rural health services. So, when we talk about the structure of primary health care in Malaysia, earlier there was three-tier system from 1956 to 1970, and after 1970 to present there is two-tier system. So under this three-tier system, there are three levels of services. So these three levels are main health services. There are main health centers for 50,000 population. There is one health center for 50,000 population. Under that main health center, there are health sub-centers which covers 10,000 population. One sub-health center covers 10,000 population. That means under main health center there are 5 sub-health centers, and under the sub-health centers there are midwife clinics. One midwife clinic covers 2,000 population. That means there are 5 midwife clinics under sub-health center. So, doctors, dental officers, nurses, health inspectors, laboratory assistants are the staff you can see in main health center. But in sub-health centers you can see medical assistants and nurses only. When we talk about the nurses, public health nurses as well as midwives are included under nurses. Then in midwife clinics you can see only the midwives. So under main health center they provide outpatient care and dental care. Sub-health centers provide outpatient screening and maternal and child care, and midwife clinics provide home delivery and home visiting. So that is about three-tier system. Now in Malaysia, two-tier systems is existing. So under this two-tier system, there are you can see only the health centers and community clinics. One health center covers 20,000 population, and one community clinic covers 4,000 population. So in these health centers, you can see doctors, dental officers and nurses and medical assistants, and in community clinics you can see community nurses and midwives. So and under two-tier system, health centers provide outpatient care, maternal and child health care, environmental health, food quality demonstrations, health education, family planning and dispensary. And community health clinics covers maternal child health care, home delivery, home visiting, minor care for minor ailments, and family planning services. So that's the basic structure of primary health care in Malaysia. Now you can, at present you can see only two tier system. There are two levels of community health care or primary health care, and there were three levels of services before 1970. Okay, so now I would like to give you an exercise, small exercise. You have to find out the structure of primary health care in Sri Lanka. So now we'll talk about the standardized practice and educating community or public health nurses. There are in this table it says how uh, these community health services uh, developed from the past up to present. So, and in each phases who was the focus, and then what are the services available, uh, like that. So you can um, you can go through that and get some idea. Now we'll talk about the role of world and local health agencies related to public health nursing or community health nursing. So first we'll talk about the largest organization, World Health Organization. Um, so World Health Organization fulfills its objectives through its core functions as follows. So these core functions are first one, providing leadership on matters critical to health and engaging in partnerships where joint action is needed. Second, shaping the research agenda and stimulating the generation, translation, and dissemination of valuable knowledge. Third, setting norms and standards as well as promoting and monitoring their implementation. Fourth, articulating ethical and evidence based policy options. Fifth, providing technical support, catalyzing change, building sustainable institutional capacity, and last, monitoring the health situation and assessing health trends. So in this period actually you can see you will be able to see what is WHO's roles in this COVID pandemic. So you can identify their roles. So again I would like to give you a small activity. So that is, what is the role of WHO in Sri Lankan public primary health care? So under this you have to talk about what WHO has done for the primary health care of in Sri Lanka. So when we talk about the public health system in Malaysia, we have to go through the mission of the Ministry of Health in Malaysia. So the mission is to facilitate and support the people to attain fully their potential in health, appreciate health as a valuable asset, and take individual responsibility and positive action for their health. Uh, Second, to ensure a high quality health system that is customer centered, equitable, affordable, technologically appropriate, environmentally adaptable, as well as innovative, and finally, with emphasis on professionalism, caring and teamwork value, respect for human dignity, and community participation. So that is the mission of Ministry of Health in Malaysia. So by going to this table, you can see the life expectancy and mortality rates of Malaysia. So I think you have rough idea about the life expectancy and the mortality rates in Sri Lanka, so you can compare these two. Uh, Now we'll talk about the Family Health Development Division in launch under the Ministry of Health. So, the Family Health Division is the heart of the public health service in Malaysia at the primary level, and it is parked under Ministry of Health. So, these are the focuses of Family Health Development Division in Malaysia. There are six focuses. They focus on maternal health, perinatal, neonatal and child health, adolescent health, women and adult men health, elderly health, and rehabilitation services and special needs. So, uh, in this lesson, we talked about the how public health nursing uh, or the community health nursing launch in Malaysia and several other countries in the world. So, I would like to summarize the lesson as a summary. Public health is a scientific discipline that includes epidemiology as well as statistics and assessments, which include attention to behavioral, cultural, and economic factors. A community nurse is any registered nurse who works in the community setting, whether or not he or she is educationally prepared for public health nursing. Religion plays an important part in the early development of public health. The role of religion continues until today, whereby health is associated with spiritual, ritual practice and consumption of food such as honey, black seed, as recorded in Quran, while Christian missionary nurses are working in hospitals. Next, British ruled the longest, thus Malaysia inherited the British system of healthcare delivery as well as other systems like law. Nursing practice in the pre-war era in Malaya was carried out by nurses without structured training. A well thought out initiative to improve the health of the people was seen in the policy set up by the first Malaysia Plan. The roles of World Health Organization are mainly on world policies for improvement of health of the world population. The social goal of WHO and its member states is that the world achieves health for all by the year 2000. The Malaysian healthcare system is largely government led and funded by public services under Ministry of Health. The Department of Public Health is one of the main departments in the Ministry of Health. The Family Health Development Division is the heart of the public health service at primary level, and it is parked under the Department of Health. So that's the summary. Um, Thank you.